Gelocast Training Module, Department of Training and Education. Confidential internal use only. The information in this document is confidential and may be BSN legally privileged. It's intended solely for the addressee. Access to this document by anyone else is unauthorized. If you are not the intended recipient, any disclosure, copying, distribution, or any action taken or omitted to be taken in reliance on it is prohibited and may be unlawful. Topics: treatment options, product history, product information, indications and contraindications, application, reimbursement information, patient care, and frequently asked questions. This algorithm discusses the various compression treatment options available to the clinician through products from BSN Medical. Although BSN defines Gelocast as a treatment choice for a non-compliant patient, the course of treatment is ultimately up to the clinician. We have heard from clinicians that they may choose the Gelocast even for a compliant patient. Paul Gerson Unna was a leading German dermatologist during the late 1800s near Hamburg, Germany. He founded a private clinic for skin diseases and in 1882 founded his own journal of practical dermatology. Unna introduced into medicine hard and soft zinc oxide pastes, including a paste along with bandage and compression materials, creating the Unna boot. Medical professionals use the dressing to treat ulcers of the lower leg and other skin and soft tissue conditions. After the wet bandage is applied, the Unna boot is molded into shape of the leg and ankle. An elastic bandage is applied around it. In most cases, a new boot is applied every 1 to 3 weeks. When the bandage dries, it produces a dry, semi-rigid but inelastic leg cast which treats leg swelling and acts like a rigid stocking. Unlike compression stockings, the Unna boot is semi-rigid and it does not squeeze the muscles. The bandage offers compression to decrease the swelling of the leg. Once the dressing dries, it becomes hard. Indications for the use of the Gelocast. Venous stasis ulcers. It provides a high working pressure and low resting pressure. It reduces edema and improves venous hemodynamics, which is blood movement. Gelocast can also be used for musculoskeletal injuries, as a semi-rigid cast for immobilization of sprains and strains, dislocations, and possibly after cast treatment. Contraindications of the use of Gelocast. Peripheral vascular disease or arterial disease with associated low ABPI. Compression is strongly contraindicated for any ABPI measurement that is less than 0.6. Uncontrolled congestive heart failure, active cellulitis, and if there is an infected wound, caution should be taken. Features and benefits. Gelocast dries quickly, which provides a semi-rigid cast. It is uniformly coated with calamine, and this reduces skin irritation and makes it easy to apply and remove. The gauze is a 100% cotton base. It does not unravel. This helps reduce waste. Each bandage is individually packed. This helps prolong shelf life. Application. Prior to application, be sure that the skin is clean. Any open wounds should be treated accordingly. The foot should be kept with the ankle at 90 degrees during the application. Please refer to the application guidelines located in each box of Gelocast. These guidelines aren't to be used as reference. Please consult a physician or other healthcare professional prior to applying. These application instructions follow the recommended application in the instructions for use that comes with the product. Variation from clinician to clinician will vary. Select a stockinette that is not too constrictive but also not too loose that could cause wrinkles and creases. Cut a piece as approximately 3 times the length of the lower leg. Roll up about 75% of the stockinette as shown and apply as seen in the picture. The rolled end should be situated just below the poplite. Start rolling the Gelocast around the foot 2 times to secure the bandage. Work the bandage up the foot towards the ankle, overlapping by 50%. Continue around the ankle and heel, smoothing any creases or wrinkles. The bandage has very little conformability, therefore it is expected that the clinician will have to make small folds in the product to fit as the anatomy of the lower leg changes. Continue up the leg, overlapping by 50%, stopping at approximately a ½ inch from the roll of stockinette. If there is any excess gauze, simply continue back down the leg. Roll down the stockinette to completely cover the Gelocast. Roll the stockinette back up the leg. Fold any excess stockinette back down the leg. Cover the entire application with a short serge bandage for additional compression. The CPT code 29580 is specific for an Uniboot. The compression dressing may be able to be billed with HCPCS codes A6448 to A6455. These are listed as being under carrier discretion, so they may or may not be covered. The application of the bandage dressing will be covered in the office visit. The patient can walk and wear comfortable shoes while being treated with Gelocast. Walking and muscle contractions assist with moving blood from the lower leg and towards the heart, and therefore is encouraged. The Gelocast should remain dry. If showering, a protective cover should be utilized, and if it does get wet, the patient should contact their healthcare provider immediately. There are multiple competitors on the market. Convatec Uniflex is an elastic bandage impregnated with a zinc oxide paste. Primer offers their Uniboot in a zinc oxide and a calamine version. Hartman USA's Econo paste is offered in a zinc oxide and a calamine version. Smith & Nephew offers Visco paste only in a zinc oxide. The Gelocast sales sheet is available at Bottomline Inc. The reference number for the sales sheet is 50995. How long does it take to dry? Since the product dries by an evaporation process, we normally do not make time claims. Along with environmental conditions, covering the applied Gelocast with a gauze or bandage can also slow this process. Also, due to the lotion content, it never completely dries throughout, but the surface dries enough so that the gel does not transfer. Can the patient walk on it? Yes, the bandage is designed to be walked on by the patient. How long does the product stay on the patient? It is normally worn for 5 to 7 days before the semi-rigid cast is removed. For sport applications and treatment of musculoskeletal injuries, the product is removed daily for injury site inspection until the swelling subsides. Why zinc oxide? It promotes healing within wound sites, making it useful for burns and ulcers. Zinc oxide paste is superior to gelatins used in other dressings because it does not harden or cake. Some Uniboots also contain calamine lotion and glycerin. What is calamine? It is a topical treatment that combines zinc oxide and iron oxide to produce a lotion that is utilized to help mitigate irritants associated with contact dermatitis. Calamine lotion often appears as a pink in color and has a thick, creamy texture. This concludes the training module on Gelocast.